All right. Good afternoon, everyone. Hope you're all staying safe and healthy and hopeful through this crisis that we've all been going through. Quick overview of the things that we're going to be talking about today around telehealth. We'll be looking at the overall landscape of the industry. We'll be talking about strategy to increase adoption, and then we'll be getting into some of the very specific tactics. First, quick intro. My name is Bill Gadlis. I'm one of the founding partners here of Imagine. Imagine is a digital agency for healthcare and life sciences. That's about as far as I'll go as in terms of a spiel about us. Um, and I'll give a little bit of an overview. I'll be starting with just the general landscape of the telehealth sector. Um, and specifically with regard to the times that we're in, there's not a lot I could say positive about a pandemic that's taken so many lives and has so negatively impacted so many more. But in times of crisis, you do have to search for some silver linings. And I think the biggest example of that has been just how society has come together in so many ways to combat the spread of the coronavirus. But also, especially for all of us that are related to the healthcare industry, we tend to see a level of innovation come out of crisis periods that just produces so many great things that will impact so many lives. Just this morning, the big news of the day is on Gilead's antiviral drug remdesivir and the positive results that have come out of that clinical trial that the NIAID has been working on. But what we're here to talk about today, and a topic that has become literally one of the hottest trends in healthcare almost overnight, is virtual healthcare, telehealth, telemedicine, all of those things. Um, Telehealth, specifically the whole concept of telemedicine, really is not all that new. You could trace back examples of antiquated use of telemedicine going back decades. But obviously, since the rise of the internet in the 90s and largely over the past decade, is where we've seen so many developments. There's just been so many great advances with the technology and the platforms. Still, the adoption rate has been, let's say, relatively weak, despite all the great technology and all of the platforms and all the conversation around this topic. It just hasn't been adopted nearly as much as most of us probably think that it should. But, with the unfortunate, tragic reality of COVID-19, it really is looking like this pandemic could, in fact, be the watershed moment for virtual healthcare and telehealth. So let's take a look at some of the statistics and some of the numbers. And a couple of quick administrative things. We're not going to do live question and answers, but we will be reaching out to everybody, and you will have a way to contact us with questions following today. If you notice some of the data and statistics we'll be presenting, if you don't see sources on the screen, we just didn't want to busy up a lot of the slides, but we will be putting those into the PDF format of the presentation. So you'll see where all of our information came from later. We might run over the hour time slot because I've asked all of our panelists to not worry too much about the clock. I'd rather they present effectively and not feel rushed. And let's get into it. So like I said, we have what I would say is very low adoption for something that is a pretty awesome technology. 9.6 of Americans have used telehealth. This is prior to the COVID crisis. We don't have any real validated data that I wanted to use as part of today's presentation since the crisis happened. So this is all prior to COVID. But less than 10% have used telehealth services. And 3/4 of people say that they don't even have access to it or unaware of their options even. Females tend to be a little bit more open to using telehealth services. Patients ages 18 to 24 have used telehealth more than any other age group, probably not very surprising there. And seniors with the lowest utilization rate. Adults 35 to 44 show the second highest level of engagement, with 11.8 saying they've utilized telehealth services within the past year, And like I said, females considerably higher adoption rate than males for some reason. Just low levels of awareness that are hindering the adoption. 40% of consumers say that their health system or insurance provider does not even offer the services, which is likely to be not accurate. While another 35% or so say they're unaware that the service is even offered. This is ironic. Telehealth largely was geared toward folks in rural areas that just didn't have as much access or don't have as much access to as many clinics and hospitals and physicians always being nearby to them. So, it's always been thought that telehealth would really be appealing to them, but they're actually show low awareness. So very pronounced, 72% lack of awareness where it's actually supposed to increase access. Only 8.7% of rural residents have adopted the service compared to 11.7% in suburban and urban areas. People are concerned about quality of care, naturally. Half of those in this survey believed that they'll receive lower quality of care than if they were in an office, while only 6% would perceive the quality of care to be higher, and 45% believe it to be about the same. And 43% believe that a telehealth session would be less personal than if they were in their doctor's office. Millennials are fans. Again, I don't think that's much of a surprise here. 74% of millennials prefer a telemedicine approach than a traditional visit to an in-person appointment. 71% of patients want to be able to schedule their appointment through a mobile app. 26% would actually switch from their primary care physician for another one who offered video visits. So not a lot of loyalty there. And 75% that have used telehealth technologies rated it as superior to a traditional clinic visit. So moving a little bit over to physician adoption, some of these stats came out of our friends over at American Well did a great survey on HCP adoption specifically. And so some of the data came out of there. 69% of physicians said they would be willing to use telehealth, which is up from 57% 5 years ago. So that's pretty promising. And again, not very surprising here, younger physicians are more willing and less unsure about telehealth as compared to older physicians. The reasons that doctors will give for adopting telehealth, they feel it gives them increased access to patients, probably true. A more flexible work-life balance. We all know that especially primary care, but all doctors are pretty much overworked. So work-life balance is very important to them. They feel they can attract and retain new patients by offering the service. They feel they can improve patient outcomes, and they want to be on the leading edge and show their audience that they, are using the most innovative solutions in healthcare. The industry's objectives, this come out of the American Hospital Association, is, they want to expand Medicare coverage with adequate reimbursement, obviously, so that more people don't have to worry about the cost to use telehealth, telemedicine services. They want more federal research on the cost benefits of telehealth. Cost, obviously, I can safely say, goes across the entire healthcare continuum. It's not just a cost savings to the patient. It's a cost savings to the physician. It's a cost savings to the facility. It's a cost savings to payers. So, but the American Hospital Association wants to see more research specifically on that. And improved access to broadband technology in rural areas, obviously, by the FCC. So the AHA wants to see more government initiatives related to telehealth. So telehealth considerations kind of broken down into categories. You've got your segments of telehealth, telenursing, telepharmacy, teleradiology, and so forth. You got considerations in terms of what components you might need, software or hardware, the type of deployment that a facility will deploy, whether it's cloud-based or equipment and servers right there on premise. by application, obviously, things like cardiology, ophthalmology, psychiatry, radiology, and those all have different levels of adoption within. I don't get into each of those in detail here, but again, if you want to reference, American Well did that in their report, pretty in depth. If you want to check that report out, and by end use, in terms of hospitals, clinics, home care, and so forth. So some of the advantages of telehealth: quality of care, convenience, obviously. Improved access, more people able to access doctors who may not be able to get across town or into another town to their doctor's office. As we said, cost savings, and again, not just for patients, but across the entire healthcare continuum. Timeliness, more patients. But some of the disadvantages that are perceived of using telehealth: obviously, doctors are mostly concerned with difficulty in diagnosing certain things. So patients are concerned about that, but so are the HCPs significantly. Complicated policies and rules, obviously always a concern in healthcare and adopting any new technology. It's been a nightmare for a lot of physicians with the emergence of EMR and EHR systems over the past couple of decades. And so with each new technology comes a whole slew of new regulations that come with that, which is a challenge, obviously, for anyone in the industry. Glitches, electronic and internet glitches, lack of physicians in general. There aren't enough doctors, let alone enough doctors who have adopted and understand telemedicine perfectly, and privacy issues with any sort of technology, especially in healthcare. Those are big concerns. So now we're going to move into some of the strategic components, and I want to introduce David Hubble. He is Imagine's Director of Strategy. So David, take it away.
Thank you, Bill. So I wanted to start with some background context. If we can go to the next slide. What you're looking at is based on a McKinsey article that was published in the 2008-2009 fiscal crisis, which was our last structural break. That was about financial markets. This one today is about our healthcare systems and delivery. The thing to remember here is this idea of opportunity in disguise. And that opportunity, we believe, is the advancement of virtual health. Right now, everybody is surviving, but some will also benefit from the new patterns that emerge after this. And that means change and doing things differently. So let's take a look at the events that led up to healthcare structural break. Prior to COVID, virtual health was an emerging idea, and barriers such as reimbursement, regulations, and longstanding norms of in-person visits and everything stood in the way. COVID changed that when it affected hospital capacity, patient safety, and the overall survival of healthcare systems. The big break for virtual health came with the declared national emergency, and that included the call to avoid in-person visits, rate parity, which was a big problem, and eased regulations. What has driven it forward is the existence of readily usable technology, cost and reimbursement, and the long waits to see a doctor that were already in place. And as for the result, virtual healthcare interactions will top 1 billion by year's end, according to Forrester Research. In the past 45 days, we've seen virtual healthcare transition from an idea to a necessity. So we wanted to look at some possible scenarios. What happens, after this is over? The question becomes, can it be taken to the next level and become a competitive advantage? And so we thought about where, after the dust settles, what might happen. So the first scenario is we collapse back to pre-COVID behaviors, basically a continuation of inconsistent approaches. Second scenario would be having momentum, providers understand the value, more fully adopt, perhaps with full-featured platforms, and over time, consistency could evolve. And scenario 3, which is very interesting, is the possibility for an Uber-like entity who invests and creates a disruptive delivery and experience, and in some cases displaces traditional care. Here's a key point. Healthcare will change after this. Patients will benefit regardless, but individual provider landscapes may change for the good and not so good. It's time for providers to start thinking about how virtual health becomes a competitive advantage. So we went out to some of our clients to understand how they were dealing with this and what was going on. The first one that we'll talk about is a leading cancer center. And they had nothing in place prior, and the change in government regulations became a key factor to be able to start to implement. There was a significant learning curve, they said, for the doctors, administrative folks. Patients were notified if it was an option, but here's the interesting thing. Word is the patients love it. And age, which you would think may be a factor, is not. They said they have 90-plus-year-olds figuring it out like it was nothing. So that's really good news. Zoom is a platform. It's supported internally, also use FaceTime in some cases. And an interesting twist to it, idea, is that 30 minutes prior to a visit, the patient enters a virtual waiting room so that they don't have any problems with seeing people at the right time. Second one was a large physician practice. COVID really drove a system-wide effort pretty much on the fly. They encountered no roadblocks. Doctors got it, little or no pushback. And according to their patient experience manager, all has been really positive so far. Again, Zoom platform with internal training through their systems group, and emails go out to patients to notify of, virtual visits as an option where they make sense. The third one is a leading neurological institute, and this one was really interesting. They did have a system in place for movement disorders like Parkinson's, and iPads were being sent to remote areas to facilitate that. But post-COVID, virtual visits have been fully implemented within the neurology clinics, and it currently represents 75% of all visits. And some of the doctor quotes, this is awesome, it's so efficient, effective, and they say they have not had one single negative comment from the physician participants. They're currently seeing 150 to 180 patients a day. And again, it's a HIPAA-compliant Zoom platform. They also include a pre-visit tech check with patients a week prior. And that's to assure that there's no glitches. You're going to see in a minute, the older audiences are very concerned, will it work, and all that kind of stuff. They take that right off the table to create a really great experience. And now they're figuring out what happens post-COVID, like a lot of people are trying to do now. So I want to go through this quickly, and we can give you more information if you're interested. But, patient and healthcare provider audiences are far from amorphous. They don't all behave the same. And we believe that age is the largest demographic driver for patients and HCP differences. For that reason, any strategy really needs to address these differing personas with different approaches and different messages. A blanket announcement is just not going to work. And yet, that's what we're seeing from a lot of these people in the COVID era. What we're talking about is moving beyond that. So let's start with some differences between these groups. The youngest, obviously they're the healthiest group. They spend about $2,000 or less a year. Early adopters, they're most tech savvy, digitally exclusive, and they trust absolutely everything they find online. They also trust peers more than doctors, and from all of our research, we've found they often question the doctors about the care that they're prescribing. 100% internet use. Google's the preferred search engine. Almost 100% are on social media for an average of almost 3 hours a day, and smartphone's the preferred device. They're on the go. They may have young children, and you might hear them say something like, I can do everything else online. Why not doctor visits? The middle-aged group, moderately healthy, 5,000 plus a year, and they are still tech savvy. Online's really a matter of convenience. They trust the doctors. And, you know, the same kind of internet use and social media is just a little bit less. These folks have really busy schedules, children in schools, activities. They're more financially stable, higher cost of health insurance. But here's the really interesting thing. This is what you call the sandwich generation. They have their children and they have their parents. And so at any given time, these folks can show up, you know, at the healthcare system representing the children, themselves, or their parents. So it's a really important audience to think about. And then the older group, they're least healthy, obviously. They spend over $10,000 a year in healthcare. And they're less tech savvy, but I really want to make this point, is they are fully technology capable. And it's really a misnomer to believe that they're not. And I think that's really important to keep in mind. And, you know, 50% of them use what they call their phone, and 50% use home computer. So something to keep in mind. And their biggest worry is going to be, does the technology work? So if we move on to the HCP audience, we're going to see here again, age is really a primary driver for their differences. You can see that U.S. physicians are skewed to older age groups, and physician willingness to adopt virtual health is lowest for the older age groups. And, you know, this goes the same for technology in their own personal lives. But, you know, here's the key point. Studies tell us that those who've used it once see greater value. So let me say that again. Those who have used it once see greater value. Only one time. I bet you there's a lot of people in marketing that would wish that changing behavior was as easy as trying something once. The structural break has forced many of these guys to adopt, and I believe that we should see an acceleration of acceptance and adoption. You just heard me go through the 3 examples, and in all cases, there was not a negative word. All physicians were on board. Last point, which was really interesting, is there are differences between specialists and primary care, obviously. And the one interesting fact to keep in mind here is there's a high correlation between physician burnout and greater interest in virtual health. Seems to make sense, right? And specialists tend to have higher burnout rates. So something really to keep in mind. So let's move on. I want to talk about how we alter the entrenched behavior in these 2 groups. There's an old adage in marketing that changing perception is relatively easy, but changing behavior is very difficult. And research tells us that most patients and providers can state the benefits of telehealth. So there it is. We've already changed the perception out there. The trick is getting both patients and providers to try it once and have a good outcome. I was saying that before. And, you know, this becomes the key element in changing behavior. Our current conditions, right, provide an excellent opportunity to change perception and behavior. And a couple important points on strategy is that you really want to present virtual visits as a permanent improvement to service and care, not a temporary COVID replacement. The sooner you start to do that, the better you're going to be post-COVID. And you should begin planning your strategy now for making virtual healthcare a competitive advantage after COVID. And here's why. 93% of patients will readily switch providers. And so there really appears to be a weak allegiance to incumbent providers. And it means that virtual healthcare may result in lost or gained patients depending on what you do. So Bill, just staying on the same slide here, let's talk about altering patient behavior. For starters, the patients are ready. They've been ready for a long time, but they're going to adopt for differing reasons. And it's a lot to do with the age demographics. So for instance, as Bill mentioned earlier, 74% of millennials prefer telemedicine visits. They're already there. The older audience probably going to be a little more reluctant, but you know, you can start to think of it as a social movement. It's easy, it's convenient. Others are doing it, and that may move the needle a bit. All patient audiences, they need to know what procedures are in and which are out, how to conduct the visit, and if it's covered by insurance, which is really important. So just a couple of ideas here also to improve patient experience, because again, that positive experience will drive follow-on visits and the behavior is changed, right? One is that pre-visit tech assist that I just mentioned. The other is the virtual waiting room. And I would say add to it, rate your visit today, just like Uber, rate your driver. And, you know, listen to that feedback and adjust accordingly, because it's all about getting patients on board. If we move on to altering physician behavior, there's always a possibility for some to be reluctant. I was actually surprised to hear that ground, you know, level information about our clients and how it was going, and that physicians were totally on board, which was really good news. And the other part of good news is this is a really rational audience. So you just really have to work with them in altering their behavior to include them. And you really have to close the loop on three things: clinical appropriateness. It's just as effective. It's the proper thing to do. Reimbursement, as I mentioned before, and that leadership in the organization supports the change. It has to be top down. Everyone on board, no exceptions. It can't be half of the physicians went ahead and half didn't. You know, the smart organizations are assessing their continuum of care. So you think about things on one end of the continuum that are very simple to adopt, like mental health. And on the other end of the continuum where they're currently unadoptable, like brain surgery, right? And you want to kind of move from the left to the right as time goes on. And you want to include time to formally train the staff, and they should know that up front, and you know, build their positive experience as well. So we'll shift gears again, and I want to address position and messaging to virtual health, you know, virtual health to our audiences that we've been talking about. So right now, you can require virtual health visits, and that's just the way it is, but that's not going to last. To create the permanent change, you really have to message consistently and act accordingly. So just a few steps here. I think the first is to create a top-level position and approach, and you know, and messaging, and it really has to cover why, what are the benefits, how, what's the technology, and what's that continuum of care, which, you know, procedures will you be doing virtually. Step two, which is really important, is to implement a multi-channel approach. I've seen, even from my own provider, you know, things just a letter, you know, and that's it. Your website should be updated. Use mail and email from the physician to the patient, not from an administrator, because that's where the relationship is, the physician and the patient. Tactics should include search, paid advertising, social media, online groups, and a lot more. And other avenues that you should be thinking about is a physician narrative, so that when the physician is meeting with a patient, they can tell them that telehealth is available. In-office display, local advertising, and even, you know, if you really want to get specific with audiences, older audiences spend a lot of time on talk radio. So if you're local, you do local talk radio. And then the third step really is to measure and perfect that patient experience. And I can't emphasize enough how important that is. You've got to measure, you've got to know what the satisfaction rate is, and you got to see if you've got people returning for a second visit. That's going to tell you things are working. So messaging to patients, a few things to take into consideration. The key benefit is really simple. It's the same visit with less time wasted. Mass General just recently did a study, and with face-to-face, 95% of the time is with the physician. For in-person, 20% of the time, because you have to drive. And, you know, Mass General, Boston, that's a tough place to get to anyway. The tone should be professional, testimonial-driven, and no need for apology. I got a letter from one of my providers, and they said, we're really sorry that we have to do it virtual health. I just thought they're totally missing the point, so don't do that. And the words you use are really critical. Words such as visit, face-to-face, highest quality care, connection, your doctor-patient relationship. And then, you know, the last point here is, again, and I've said it a couple of times, you've got to address each age group with different reasons and message to them accordingly. So last thing, closing, I wanted to provide some sample messaging. And you're going to see the differences in how technology is addressed for each demographic, the benefits, and the different words they use and your message should include. All right. So for the younger patients, technology makes everything better. That's how they see the world. And now you can virtually visit with your doctor from your smartphone for many standard procedures. It's very short and to the point. There's really no explanation required. They get it. Take a tour. That would be, the call to action. For the middle-aged, we know your days are busy. Remember, this is the sandwich generation group. Your time is important. We're taking one off your list of to-dos, making this easier for you. Now you can conduct doctor visits virtually, same visit without traveling to the office. And then for the older ones, you're going to use some different words here. Not every visit with your doctor needs to be at our offices. Some can be conducted from your home. Advancements in technology allow us to meet with you on your phone or computer. That's what they call it. And we'll make sure you're properly set up prior to your virtual visit. Call us to learn how to move your next visit out of the office. So just some thoughts there. Again, the key point is that you're going to want to have different messages for each of these audiences. So last slide for me is I was thinking about it the other day, and we've basically come full circle, from house calls to office visits, back to house calls, but via telehealth. So kind of, interesting to think about. So at this point, I'm going to hand it off to my colleagues, Megan and Jen, who will address the digital tactics involved, and we'll start first with Megan.
Great, thank you, David. I'm Megan Beretta, SEO strategist at Imagine, and I'm going to talk to you about, like David said, the tactics from a digital marketing perspective. Next slide, please. So David provided us with a lot of great information on strategy and personas and messaging. And really what I'm going to talk about is the tactics to consider and the content you should consider. As you're working through and developing your personas and messaging, you really want to take a look at your digital landscape and know what's out there. So doing the proper research and using the data to help inform your messaging should be a big part of your strategy. Looking at the keyword research, look how people are searching, as David said, pointed out in those personas. Look at the words that they're using. The younger generation uses smartphone versus the older, which might just use phone. But again, you want to do that research, and especially looking at geolocation. So the example below is showing Michigan and looking at telehealth, online doctor, and virtual care search trends. And as you can see in Michigan, and specifically diving into Lansing, Michigan a little bit more, online doctor is more of the preferred term that is used when searching. Virtual doctor isn't used at all, and virtual care. So using this data and information can really help drive that message so that you're connecting and saying the right thing, using the right terms when speaking to your audience. You want to look at general terms and then dive into more specific service line related terms as well. You want to make sure you're looking at the search volume, so making sure there is volume there on an average search volume, and also looking at intent, which we'll get into in the next slide. But the other side of this too is you want to look at what your competitors are doing. What type of content are they producing? How are they promoting that content, and through what channels? As David mentioned, that multi-channel approach. So are they using social media to get their message across? Are they advertising on podcasts or on talk radio? But really do that in-depth research. The next thing we'll look at on the digital landscape is search intent. You can go to the next video. And this is a really big one, obviously for me, for SEO, but search intent and what's showing up when you actually search these terms. Google adapts its algorithms based on events and times, and it changes based on that user intent. And there's different intents when you're searching for different terms. You know, some are informational results, some are transactional results. But as you can see in this example here on the left side, you've got search results from January of 2020, searching for Alcoholics Anonymous. And it's a pretty informational search. It's answering the question, you know, what is AA? You've got some people also ask questions there as well. But then if you look at the April 2020 results, it's shifted because of the current pandemic. You've got that, you know, the COVID alert above there, but then you see they've added these top stories. They've added, you know, the bottom line here is highlighting online meetings, because somebody now, that intent has changed. Somebody searching for Alcoholics Anonymous right now might be looking for a meeting, but you can't go to a meeting in the current situation. So they've shown other options there to show the online meetings is now an option. So it's really important to take a look at that overall search results and continually stay on top of that, because the results are constantly changing as Google adapts to the searcher's intent. Next slide. So you've done your research, you know your keywords, your topics you want to target. So now it's time to put that marketing plan together. These are just some quick questions to ask yourself or think about as you're creating that marketing plan. So, you know, what are the goals? And this is a more high level one, but, you know, visibility and awareness of the new service offering, both internally and throughout the community. And as you develop the plan, keep that in mind so you can identify those pieces of content that are needed to meet that goal. What is the budget? How do you reach your target audience? Through what channels can you reach your target audience? And then another really important one is measurement. So what does success look like? And that can vary based on the content. You know, if you've got a web page that you've added, you know, you might want to look at sessions and page views, or if you have a call to action on that page, then it's, you know, the conversions from that call to action. But you really want to start to build this plan so that you have a guide. Next slide. So this is an example of a marketing plan that you would want to put together. And really what you want to do is think about what content is needed and what that content looks like. Use this as your guide, and then identify those important pieces or areas to start with. Prioritize what's important. So if you're right now just starting to dip your toes into the telehealth and online services, you know, you might want to start with the website, Google My Business, social channels, and even your email newsletters to get your message out. And then consider creating the flyers and brochures for offices to have in the office down the road as you start to phase into your different openings. I'm not going to dive deep into all these pieces of content, but the two that I have highlighted, the website and Google My Business, we're going to take a deeper dive into because they specifically relate to SEO and organic search. So first, let's take a look at your website. So for your website, what you want to do is identify those new pieces of content that are going to need to be created, as well as audit through your site to find those pages that are going to need to be updated to convey that message. New pieces of content would be the overview page of the service. And as David mentioned, you want to explain the service, you want to set the expectations and walk them through the process, you know, from appointment to, or from scheduling the appointment to the appointment, and even after the appointment. What can the patients expect through this whole experience? Again, throughout this content, you want to reassure that level and quality of care is going to remain the same as they would get if they came into the office. List out those conditions that you will be treating via the online services. You know, any technology requirements, policies and guidelines, any insurance information you can put on there. Really just a nice overview page of what that service is and what patients can expect. And then the other thing you want to consider creating is an FAQ page. You can start off with standard FAQs, and then as you, you know, get more feedback and you have more appointments and you start to see certain questions popping up over and over again, you can continue to add to that FAQ page and really build that page out to provide the best information to your patients. Incorporate testimonials to the site as well. Again, just those testimonials will reassure that quality and level of care that you're providing. And if you don't have testimonials, start collecting them. And then as you get them, add them to your website. You want to look at your service line pages and update the information on your service line pages for those specific services and conditions that you'll be treating, highlighting that you do offer this now as a telehealth service, as well as looking at your meta descriptions. So those meta descriptions is the little, 1 or 2 lines you see just underneath the search results on the SERP, the search engine results page, describing what that page is about. So another opportunity to communicate with a prospective patient or existing patient that you're offering this now as a service. And then review your website CTAs, call to actions. You can update existing ones, or do new ones need to be created, but really identify those pieces that need to be updated. Update your physician profiles that they're taking online appointments, just as you have, that they're accepting new patients, or the languages that they speak. Just make sure that those physician profiles are up to date and comprehensive. And then the other thing you want to look at is internal links. So you want to link to these corresponding pages so that it's easier as the search engines crawl the site to find these pages, but then understand how that content relates to each other. So next we're going to look at Google My Business. So Google My Business is a free tool that Google offers, and it's really another way to manage your online presence. And it's a tool that Google wants you to use. 87% of search happens on Google, and you want to make sure that you're showing up when these searches happen. So an example here is pediatrician near me. And as you can see on the right, this is the result that comes up on the phone when you search for this, and it's all local. You see the local map, and then you see the 3 listings below that. And those 3 listings are coming from Google My Business. So Google's whole goal when you search is to provide the answer to your query and try to keep you on the search results page. They want you to stay on their entity. So as you can see, even right here in this result, I can click to call the location right from my phone without even visiting your website. So it's really imperative to have a Google My Business profile. So Google displays local results based on your location and then the relevance to the query that you're searching. So every location and physician should have a Google My Business profile. Next slide, please. So how important is Google My Business? This was a survey done by Bright Local. They surveyed industry experts, digital marketing industry experts, on how effective an optimized Google My Business is for improving your SEO rankings. 82% agree that it's very effective in impacting that local pack like we just talked about on the previous slide. And so it's just important, I can't stress it enough, to have that profile and that profile optimized. Google My Business is that first impression and opportunity to connect with patients, especially for hospitals, medical clinics, practices, and physicians, because it's so locally driven. And again, like I said, it drives that local pack. So you really want to make sure you've got that profile optimized and up to date. So now we're going to dive into some optimization. So this first slide here is really a general kind of overview on optimizing your Google My Business profile. You can do a lot with Google My Business. And so I'll go through some general things here, and then on the next slide, I'll dive into more telehealth, telemedicine related optimizations you can do. So in general, if you don't have a Google My Business profile, you need to claim your profile. Search your business out, there's a way to claim it, and then you'll have access to it. And once you get access to it, you want to make sure your name, address, and phone number are consistent with the information on your website and within your social channels, so that it's all across the board. Google can start to connect and realize that this social profile is you. And then there's an option for selecting a category. And you really want to be as specific as possible when choosing this primary category. You can see in the picture on the right, they have general hospital listed as the primary category. So again, being as specific because it's going to drive that relevance that I talked about in the other slide with the search results. You can add secondary categories as well, but again, keep it consistent, be specific as possible. And then you want to add your office hours, and there's a way to add your web address link. So as you can see on the right, I can click to call right from here from my phone. I can click on the website to visit your website. So again, making sure that you have that information and it's up to date. Again, these are some high level general ones. There's more things that you can do as you see services. You can add services there, but wanted to really call these out as important aspects to optimize your profile. So now we'll dive into telehealth, telemedicine specific optimizations. So Google is constantly improving Google My Business and adding new features. And with this current pandemic, they've added a way for you to communicate a little bit more on your service offerings, but also with the COVID-19 updates. So as you can see on the left there, there's See COVID-19 info for visitors. Through the back end of your Google My Business profile, you can add a link to your COVID-19 specific page if you have one, so that people seeing your profile can click on that link and get more details. And then just below that, you can see there's now an option to add this Get Online Care link. You can link to your page to schedule an appointment. You could link to your overview page, but you really want to make sure you have that information in there so that when somebody does find your profile, they can see right away that you offer this service. The other area you want to add telemedicine or online visits is underneath services. You can add different services. I would add that, and then you can also add a little description as well below that. And one of the more powerful things that you can do with Google My Business is create posts. And so this is your opportunity right now and down the road to focus on telehealth and telemedicine posts, educate your potential patients, and really get that message out there. You can use it to post other information as well, but telehealth, telemedicine specific information will get it out there. And posts, you can post a new post every 7 days, so they expire after 7 days. So this is really something that, just as you have maybe a social media calendar, you really want to incorporate your Google My Business into this kind of ongoing calendar and checking it and keeping it up to date, scheduling posts or posting every 7 days so that you're keeping that information fresh. Google likes to see that you're using its tool. The other thing that you can do is create events. So right now, if you're offering virtual support groups or webinars, add those to your Google My Business profile as events there so that, again, when people find your profile, they can see all of this information about your business. And the other thing you can do is add photos, you can add videos. Again, there's a lot you can do with Google My Business, but it's a big driver for local search. So it's just really important that you have this as part of your marketing strategy. So I've covered these areas really that focus kind of on that organic side of things. My colleague, Jennifer Martyr, is now going to talk to you guys about paid ads and the importance of having them as part of your plan.
Thanks,
Jennifer?
Megan.
Yep.
So now that we've gone over the SEO strategies, I'm going to talk about paid advertising. And I'm really going to start with Google search ads. And this is the most effective way to generate patient volume because you're getting in front of patients when they're looking for you and your services. For example, when someone searches for pediatric telehealth and you're bidding on that term, your ad is going to show up. With that said, there are several different campaigns that you can run. First, you can start off with a branded campaign. And this is by targeting keywords with your practice name or your doctor's name in it. And it really allows you to promote your telemedicine services to existing patients who are searching for you. You can also create a service-focused campaign, and this entails bidding on keywords for all the services that you're offering through telemedicine. If you are a primary care physician, you can run campaigns that focus more on the general terms, such as virtual health, virtual doctor, or telemedicine doctor. Other strategic campaigns that you can run can be focused on specific areas. So you can use the radius option to target a larger range of users, since most patients may not actually have to visit your office. And like Megan mentioned, you'll want to do your research because there's specific search phrases that are used in particular areas. The image below shows several areas within Arizona where people are using different keywords for the same service. So it's always just a good idea to do your research before creating these campaigns. Moving on to display in YouTube. Since March, we have seen an increased activity on the Google Display Network and YouTube. And this is because people are at home and they have time to absorb more content, either through reading articles or watching videos. And this really just gives you an opportunity to diversify and advertise across networks. The display network allows you to use image advertising on websites, and these are the banner ads that you see when you're reading an article. And then with YouTube, it really gives you an opportunity to use the video ads to connect with potential customers in a more unique way. And Google makes it easy to create simple ads on both networks. Moving on to social media. So you'd be missing out on a huge opportunity if you didn't run social ads. Social platforms have targeting capabilities, which really allow you to promote your new telemedicine services to potential patients. And the first graph shows that 79% of users on Facebook range between 18 and 49 years old, and 68% of users are 50 to 64. And some of the services that are in line with these demographics include pediatrics, family medicine, and chronic condition management. And these specialties can be done easily through telemedicine. Moving on to Instagram. So you should really prioritize advertising on Instagram if your target audience is under the age of 40. This graph shows that most users are between the age of 13 and 29, with 47% of users between the age of 30 and 49. So wellness checks, mental health visits, and dermatology are just some of the services that are in line with these demographics. And like David mentioned, these audiences are different, so you'll want to adjust your messaging accordingly. So now that you've implemented your SEO and your paid strategies, you should focus on what people are saying about your new telehealth services. And this is where we use social listening. So what is social listening? It is defined as the process of understanding the online conversation about your company as well as your products and your services. It really allows you to gather and analyze customer data from a variety of social media platforms and on the web. And I honestly think most importantly, it allows you to understand what your customers are talking about, what they think, and how they really feel about your business. And this topic cloud to the right is just an example of what keywords and phrases that your business is best known for. So as you shift your strategy to focus more on telemedicine, you'll want to see more of the terms such as telehealth, telemedicine, and virtual appointments become more prevalent. Next slide. So within social listening, you can easily monitor mentions of your brand and your product, such as your company name or even high-profile employees. And the first graph shows a breakdown of mentions within a certain period of time. And you can also track sentiment. So understanding what people think and say about your company and actively improving your online reputation. And the second graph just shows an overview of positive, negative, and neutral reactions from people talking about your brand. Next slide. So moving on to competitive analysis. So you have the ability to track what your competition is doing. So what types of services are they offering? How are people responding to those services? Are they offering any discounts? You also have an opportunity to understand their online visibility. Do they post often on social media? And if so, what channels? Are they posting high quality content on their blog? So a lot of deep dive analysis that you can do. You can also see real user feedback on their products and their services, which is really interesting to read through. And ultimately just learning from their tactics. What's working for them? What are their pain points? And how can you do it better? And moving on to the customer service slide. So customer service is an area that all businesses should focus on. And within social listening, you can monitor tagged and untagged brand mentions. You can respond to customer requests. So if someone's asking a question, you can answer them quickly. You can also handle customer complaints. It's so important to respond to someone who's had a bad experience. Other people see that you're interacting with them, and it just really shows that you care. You can also acknowledge positive feedback. Not all feedback is negative. When someone gives you a good review, you can touch base with them and just thank them. You can also set up alerts and notifications for real-time updates. So when someone mentions your company, you get the alert and then you have the ability to respond. And all of this communication really just makes you relatable to existing and potential patients. Moving on to influencer marketing. So these are the people and the organizations that share content relevant to your business and your industry. They are a part of the social media communities, and they often have a large social following. And they can really reach your target audiences and build that trust and drive the engagement that you're looking for. And this is really an opportunity to reach out to them and partner with them to promote your new telehealth services. So there's a lot of information and data that you can get from social listening, and all of it can really help your company, especially as you implement these new strategies. Back to you, Bill.
All right, so somehow, miraculously, we ended right in an hour. Obviously, there's a lot of stuff that we could cover here, and we could probably spend a whole day on this easily. But we tried to cover at least what we felt were the most important high-level topics that would help you formulate a marketing strategy around your telehealth offerings. Like I said, we aren't going to do live question and answers here today, but we will be in touch. You can see how to contact us at the bottom of this slide. You can email me directly at bgadlis@imagine.com. You've all received emails from me promoting this webinar over the past month. So you should have those emails, but we will be reaching out to everybody that attended with the availability of this whole presentation in PDF format, a recording of the video of the webinar, as well as any questions that we can answer. And obviously we help companies with all of these things that we talked about here today, in addition to a lot of other things, from creating websites to complete digital strategy, SEO, content marketing, paid media, social media, and all of that stuff, as well as branding, messaging, positioning. So we didn't want to turn this into too much of a sales spiel here today, but we want to thank you for joining us here, and hopefully you found this informative. Please stay safe and healthy, and we'll be in touch. Thanks again.